Rabindranath Tagore quotes, "You can't cross the sea merely by standing and staring at the water. Go confidently and achieve what you have dreamt of." A very pleasant good morning. I, Lindsay Abraham, a faculty of Panna Daima Subarti Nursing College, welcome you all for this webinar on suicide prevention and awareness organized by the Department of Mental Health Nursing of Panna Daima Subarti Nursing College. Telling you about the college, our college is a pioneer in imparting nursing education in Western Uttar Pradesh. It is established in January 2000 with GNM, a 3-year course, in the name of Panna Daima, a vet nurse who sacrificed her own son in order to save the life of Prince of Rajasthan. Later on, the degree courses was established under Swami Vivekananda Subhati University, which is presently functioning under the auspices of Mahayana Theravada Buddhist Religious and Charitable Trust, which is renowned for its exemplary service in the field of education, healthcare, and social welfare. As we all know, September 10th to 16th is known and celebrated as National Suicide Prevention Week. Suicide is never a pleasant experience. As life is, so is death. The loss of someone is never explainable and measurable. Suicide is never and will not be an option. Maybe we can talk to someone and save a life. So, here I take this opportunity to introduce our resource person for today's webinar. We have among us Mrs. Betsy Chakraborty, currently working as an assistant professor at AIIMS Kalyani. A very magnificent personality with a very vast experienced career and achievements. I would like to list out few from them. Ma'am has rendered her services in many institutions, including Panna Daima Subarti Nursing College. She is a certified internal auditor of NABH and a lifetime member of ISPN, SOMI, and TNAI. She was the master trainee for promotion of mental health of healthcare providers during COVID-19 pandemic and also nationwide capacity building of nursing professionals for comprehensive management of COVID-19 in children. Ma'am has presented scientific paper and posters at national and international conferences, organized as well as served as a resource person in various workshops, capsule courses, value-added courses, and conferences. We are very much privileged to have you here, ma'am. I would now like to invite the moderator for today's webinar, Mr. Anand LR, the Associate Professor and HOD of Mental Health Nursing, Panna Daima Subarti College of Nursing, to welcome everyone. Thank you.
Jai Hind and good morning to all. On the behalf of Pannadai Mahasubarthi Nursing College, I welcome you all for this guest lecture on World Suicide Prevention Awareness Week. As we know that every year we observe Suicide Prevention Day on 10th of September. Suicide is one of the concerning and leading cause of which increase the death statistics. On this special day, to make the day colorful and thoughtful, we have a guest who is well known to our college. She is Mrs. Betsy Chakraborty, currently working as assistant professor at AIIMS, Kalyani. She is having 10 years of teaching experience and lifetime member of ISPN, ZOMI, and TNAI. She was completed MSc in nursing, mental health nursing from West Bengal University of Health Science, and masters in psychotherapy and counseling from IBAL. Completed diploma in community health nursing from NIMHANS, Bangalore. It's our privilege, madam, for accepting our invitation and being a part of this day. Welcome you, madam, and the screen is yours. You can start your section. Thank you.
Good morning, one and all present here. Am I audible?
Yes, ma'am. Audible.
Am I audible?
Yes, ma'am.
Okay. Uh, Good morning, one and all present here. I would like to thank Anand sir and Lindsay ma'am for your kind introduction, and thanks to the organizing committee and mental health department for inviting me as guest lecture. I'd like to extend my sincere thanks to Dr. Geeta Parvanda ma'am for the opportunity and for taking this initiative for arranging a talk to hour about suicide, which is need of the hour. And simple awareness can prevent all these kind of premature death actually. Death due to disease process, old age is quite obvious, but due to bad days, bad moods, failure is preventable. So suicide not only snatch one life, but disrupt whole family and stigmatize the whole society, we can say. So the persons can be the only breadwinner because we all are social being, right? So everyone plays different role in the family. So female can be a mother, can be a daughter, can be a wife. Male can be a father, can be son, can be the husband. So death totally disrupt the whole family. So moreover, what we can say like that key, what we need a little bit awareness about it. So let me share my screen because for the next 1 hour I'll be talking regarding why we need to celebrate this suicide awareness day and how we can prevent and manage suicide. Okay, so let me share my screen slides. Is my screen is visible? Slide is visible?
Yes, madam. It's visible, madam. You can
Okay.
proceed.
Okay, thank you. So the next 1 hour I'll be talking regarding what I have already mentioned, like why we need Suicide Awareness Day and how we can prevent and manage suicide. Okay, so the first thing what we need to remember that every life is precious. Okay, so we need to save the lives. And now what we can say, see according to the different kinds of data, the research data and all, that currently the suicide rate is increasing at an alarming state across the globe. And the data from the national crime record, in India also we can see like it is more than 1,64,000 death is occurring in the year by suicide in the year of 2021. And worldwide, according to the WHO, the rate is near about 7 lakhs per year. So that is the rate is quite high. So we have to take some initiatives to save these lives. And it is 12 for every 1 lakh population. And if you can see like this data, like per hour 18 death is occurring, and per 192 seconds one death is occurring. So and we can see like 58% these kind of deaths is occurring before 50 years. Okay, and why we have to think and we have to take much more initiative because moreover the victims are the adolescents who are the future generation of our nation. Like we can see the fourth leading cause of death among 15 to 19 years old population is suicide. So and the major culprit or the major reason behind this death is lack of awareness. So we need to aware the people more. We need to focus and we need to pay the attention on these issues so that we can reduce the stigma and we can raise the awareness regarding these issues. And according, if you see like our sustainable development goal also says the same things, like by 2020 2030 we want to decrease this rate at least one third. So that's why we need the suicide awareness day. Here you can have a look on the data that has been recorded by National Crime Record, major percentage share of suicides in states of our India. So we can see the rates, like it is quite high in Maharashtra, it is quite high in Tamil Nadu, Madhya Pradesh, and West Bengal and Karnataka. So we have to think about it, and we have to take initiatives. We have to aware the people. So, if we go back to the history of World Suicide Prevention Day, what we can say like that International Association for Suicide Prevention and World Health Organization, these two organizations used to play the major role behind it. And the inception year is 2003. That means from the year of 2003, we have started celebrating World Suicide Prevention Day. And still that year, annually we are observing it on September 10th, and now more than 60 countries are already observing the same. So one thing I just would like to mention, like in 2016, International Association for Suicide Prevention, they have launched an universal suicide prevention awareness ribbon. You can see the ribbon I have already pasted on the right side of the slide. Predominantly, you can see there are two colors. One is yellow and another one is orange. So now we can remember the color of candle. So color of candle, the light of color of candle is the same, like it's the mix of yellow and orange. Why they have chosen this color? Because every person who is suffering from suicidal thought or suicidal thought, on that time, that brief period, they suffered from intense darkness. What they want to come out from that situation. They want some rays of hope. They want someone can hold their hand. So what actually they want to be out of the darkness and want to enter into the light. That's why they have taken that initiative, and they have choose this color, that is yellow and orange. That is the color of the candle. In 2018, the same ribbon emoji they have launched in Twitter also. So that is all about the history of World Suicide Prevention Day. And let me talk about the theme. Though I know throughout this month of September you are listening this theme's name, but still, so this year themes was creating hope through action. It's not only for this year. It has been started from 2021, because this is a triennial theme from 2021 to 2023. Actually, they have taken that initiative because according to the World Health Organization, nearly 3,000 people on an average committing suicide daily globally. So, and they have seen like that for every person who completes a suicide, 20 or more may attempt to end their lives. So there we can stretch our hands to save at least those 20 lives, because we all know suicide is majorly happening due to the social, emotional, or economic consequences, and that is very much preventable. We can prevent this all kind of premature death, because we all know suicide is not the ultimatum. Every problem has a solution, has an alternatives. So we have to find out those alternatives. What we need to do, we need to stretch our hands so that the persons who is suffering from that persons can understand we do care for that person, and want to support that person. So that is our action, and we need to encourage and create hope, and that will automatically strengthen the prevention. That is all about the theme. So now let me come to the technological terminology that we used to whenever we are taking classes, we used to talk about this term. So like one of the commonest psychiatric emergency it is, and the commonest cause of death among the psychiatric patient. I'm mentioning here the psychiatric patient because it is the commonest among the psychiatric patient, because of maybe the psychopathological reason, but it is not the thing like it will always happening among the psychiatric patients. It may happen in the adolescents also. You can see like one failure in the class test also the persons may commit suicide. So it is not like that always the persons will be the psychiatric patient. So So what does it mean by suicide? Suicide means deliberately when we are harming self. So that is known as the suicide, and intentionally actually, and which is not culturally endorsed manner. So that things we need to keep in our mind. Regarding suicide, few more terms are there that also we need to keep in our mind so that we can understand the different stage or phase of the suicide. Like one more term is there that is known as the attempted suicide. So attempted suicide is not uh, deliberately harming self it is, but it is the unsuccessful suicide act and where the outcome is non-fatal. So then we'll be calling it like attempted suicide. So now next I'll be talking about the suicide gesture. So suicide gesture is like is an attempted suicide where the person performing the action never intends to die by the act. And one more term is there that is known as the suicide ideation. So what does it mean by suicide ideation? When the person is having the thought regarding suicide, so then and it is roaming around his or her mind, then it is known as the suicide ideation. So this is the most important side, I believe. Like suicide is preventable. Yes, suicide is 100% preventable. Sometimes the persons used to commit suicide like an impulsive act, like the person is having any bad days, bad moods, failure, or whatever it is the reason, and the intense and severe bad feelings on that for the specific or brief period of time, and they have taken that initiative like an impulsive act. But it is 100% preventable. Why it is 100% preventable? Because most of the people, we need to make them understand like that most of the people experience suicidal thoughts during their lifetime. It is not only you, but don't end their lives by suicide. If you can deal with that specific brief period of time, you can cope with the time. If you give some time, then automatically it will move. You can able to move on. So we all know that suicide thoughts can be often be very intense, very severe, but we need to remember that it is only for the brief period of time. Hence, can be overcome. That the things you need to make them understand. So the one can overcome these thoughts or urges, otherwise one helping hand also can help the persons to come out of that situation. So sometimes these kind of questions used to come to our people used to ask like that, how should I assess the risk of suicide? Because we believe that if you want to prevent suicide, if you want to help someone, it's not like that always you need to be a professional person, but you can be a family member, you can be the neighbor, you can be any good Samaritan, whatever it is, you can prevent suicide. So it's not always obvious that you need to be a professional person. What all you need the willingness to help, you need the motivation to help, and you need to spend time and your energy with the person. So regarding that thing, few myths are there, like the first sentence you can see, like it is a myth that asking directly to patients about suicide induces the suicide risk. How can we ask like that? Sometimes the people used to say like that, if I will ask about suicide, it might increase the chances. But believe me, that is the myth. The best way to find out is to ask them. Okay, if you are already a family member, if you are a neighbor, so I hope you had already a good relationship with the persons, so then there is no need to build a relationship. But if you're not, then you need to build the relationship, then you need to proceed gradually to ask the question. But what the thing is necessary, the best way to find out is to ask them. If you're not asking them, you will not have any clue about it. And if you don't have any clue, how can you save the life? So that is the thing that is necessary. So most people, otherwise one more myth is there, that is most people thinking about suicide are relieved when someone is willing to talk. That means agar kisi ne agreed ho gaya and they want to talk about suicide, then the person is not going to commit suicide. But the thing you need to remember that feelings may persist for days, months, so for a brief period of time. So you have to be very much careful for that period of time. You have to be with the person, have to help the persons, have to monitor the persons. So regarding these questions, like what I will ask. So if you're already known to the person, so you can ask like that, I'm very worried about you, I'm concerned for you. Like that way you can initiate the talk. Otherwise you can initiate like, I have noticed that you have been saying like this. If the person is saying like that, I want to die, so you can quote that thing. Or doing like this, which is unusual, which you are not doing previously. So like that you can point it out, and you can say like that are very worrisome or seem troubling, something is troubling you. So like that way you can initiate the talk. You can initiate the talk like that, there appears to be something that is bothering you, you want to share with me. Like you can share like your perception, like I think you are very much angry nowadays, you are very much sad nowadays, you're very much restless nowadays. So you previously used to be in touch with me, now you're not in touch, regular touch with me. So like that way you can initiate. And otherwise you can ask, you can say like that, I would like to understand what is bothering you, can you share with me. Can you have a cup of tea with me, and you can say that one. So like that way you can approach. And you can approach like, do you feel sad, do you feel alone, and do you feel no one cares about you, do you feel that life is not worth living. So like that way questions you can initiate, and you can initiate the communication, so that you can have a clue like why the thing is happening. So next, if you really want to identify the suicide or help, you want to help the persons. So the first thing what you need to empower yourself with the knowledge and understanding what are the different kinds of myths or facts are already there, and how you can identify the person is potential towards suicide. Like what are the warning sign of suicide, what are the risk factors, and protective factors and strategies also you need to know, so that you can help genuinely to the person. So these are the things in the next few slides I'm going to talk about. So first thing is that the common misconception about suicide. So what are the common misconceptions? Sometimes the people used to say like that, people who talk about suicide do not complete suicide. It is totally myth. Each and everyone, what they want to live in this world, right? So if they are talking about suicide, that means they want a hand, so that they want support, they want a hand which can hold them, which can support them. So that's why they are talking about suicide, but it's not like that they're not going to complete the suicide. So it is the myth. So you need to know the fact behind it. And people who commit suicide really want to die, it's not the one. They used to give you so many try to give so many warning signs so that you can save them. Okay, because no one want to die. The person does not able to bear that intense what we can say, that intense pain. The person does not want to, that maybe the emotional pain, that maybe the physical pain, that maybe the financial problem, whatever it is. But the person is not being capable to deal with that intense feelings. That's why they are committing suicide, or yeah, they are thinking about committing suicide. So suicide happens without any warning. It might happen if the person is very much the persons, few persons are like, they want, can able to cover up everything. So for that, these kind of persons it might happen, but mostly they used to give clue, that can be verbal, that can be behavioral, but you can find out some clues. They want to they used to show different kinds of verbal sign, or either different kinds of behavioral sign. But the thing is that you need to identify, you need to know about those signs. And next myth is like, once people decide to die by suicide, there is nothing you can do to stop them. It is a totally myth. You can stop them. If you know that the person is thinking about suicide, so you can be with the persons, you can support the persons, and you can be with the person for that brief period of time, and you can help the person. And next myth is that all suicidal individuals are mentally ill. It is totally myth, because yeah, we can understand, like if the person is mentally ill, the potential that it might be multiplying the chances. But the thing is that a simple 15 years old adolescents, what we can say, boy or girl also can commit suicide even after a failure. We can say like failure in a class test also, we can see these kind of things are happening. So it's not mandatory that the person should be with mentally ill diseases. The persons will be the mentally ill person. So, and next myth is like once a person is suicidal, he is suicidal forever. It is not truth. Like if you can be with the person for that brief period of time, and then you can save the person. So, what the facts genuinely need to know, that is, warning sign are a cry for help. So all warning sign you have to keenly, you have to observe all these warning sign so that you can understand the person is searching for help. And what you need to remember, this warning sign can be for days, can be for weeks, can be for even months also. Okay, so maybe the surveillance or you need to monitor for months also, for how long the this kind of thoughts, this kind of sign and symptoms will be persisting. And the thing what you need to aware about, like each warning sign is equally important, and please don't ignore all those signs. If you can able to understand, and if you had a clue regarding this, so please monitor the persons, please be with the persons, and please support the person so that the persons can so that you can help the person and you can save that life. So now I'll be talking about still the from the very beginning. I'm talking about different kinds of warning sign. So you need to know what can be the warning sign. So let me share some verbal signs. What you can see here, like the persons might talking about ending of life. Sometimes the persons might talked about like sometimes I feel like I just want to die. So this kind of sentence the person might utter. It would be better if I were dead. There is no point in living like this. So this kind of sentence you might expect. So maybe in different ways, but this kind of sentence they used to utter. Either you can see like they're talking about they're feeling very much guilty, and they have committed a sin. Might be this kind of feelings also might be there. So they feel very much guilty, and that guilty feeling is that intense they want to die. And talking about feeling of hopelessness, helplessness, worthlessness, so that also can be there. And sometimes they used to say like that, no reason to live in this world. And some they can say like that, I'm having some unbearable pain, and that is trapping me like anything. I can't able to come out from that thing. So like that way they can talk, they can give you the verbal clues that you need to catch. And they might talk about like being a burden on others. I became a burden on others, like some old age people might say, some unemployed persons might say like that. So you need to take it seriously. Now, few behavioral signs that I just want to mention, like if the person, if you can see that persons previously is not using the substances but started using substances, that can be the one of the behavioral sign. Either the amount has been increased than previous, that also you need to take seriously, and you need to encounter why it is. And being restlessness, the persons become agitated without even without even any kind of that kind of serious issues. And the persons become very much anxious, very worried about something, very much fearful about something. And the persons every time the person is feeling sad, pessimistic mood is there. The person is showing that I'm dejected for everything. And if the person is showing extreme rage or talking about seeking revenge, that also, like without any reason you can see that the person is gets into the argument, either physical fight with others. Maybe the person was not like that previously, so that you need to note. And if there is any changes in the sleeping or eating habits, that you need to ask about why it is happening like that. And if you notice that the person's become suddenly withdrawal, becoming or feeling very much isolated. Previously the person used to mingle with with everyone, but then now the person is not mingling. So that you need to take care of, and that you need to note. If you see that the person's previously using the social media, but now that person's become totally inactive, either you can see like the person has started posting different kinds of negative contents in their social WhatsApp status, in their Facebook. So you can ask, if you're the family member, yeah, if you're the well wisher, you can ask about it. If is there something wrong is happening, like that you can ask. Expressing verbal or behavioral sign on internet via platforms, and sudden reductions or withdrawal from internet platform, that you need to, at least you need to note this one, and you need to ask. And if you see that the person is not nowadays not attending anything, any social functions, any in case of occupation also, the person is not coming regularly, coming late, not is not that much punctual like previously, not been able to complete the assigned work or homework also. So then you have to ask, is there everything okay or not? Okay. And if the person is displaying extreme mood swing, like suddenly crying, suddenly becoming so much hyperactive, then you have to take it, you have to take a note on that things. Sometimes you might see like the patient might show like few preparatory behaviors also. Preparatory behaviors means if you want to go somewhere, you used to complete so many things before you were, even you can in your job also, you can see like that. If you want to mm, take leave, or if you want to do something, so you what you used to do, you used to um, mm, you used to complete all the works before going for the leave. And so like in preparatory behaviors, you can see like that giving away some belongings, and collecting medicines or pesticide, so that and that is, you can see like it is an unusual behavior. And sometimes it may see like that they are preparing the wheels. So then you have to ask what is the matter is going on. That these all signs I have already mentioned, but you can say like that few emotional signs also. Emotional signs is like overwhelming sadness. If there is overwhelming sadness is there, if there is any irritability, so these will be counted as the emotional sign. And changes in routine like sleep disturbances and appetite changes is there, then it will be counted in changes in the routine. And making final arrangements, that I have already talked about, like if they're preparing some wheels, so that will be counted in making final arrangements, or collection of any kind of means of committing suicide, like pesticide and all. And you might encounter that self-harm sign also, like cut mark, burn mark. So this also sometimes might be there, so that you need to ask how it happens. Yes, these few terms, at least you should have an idea what are these terms means, and the specific days of the weeks and specific months, you have to be need to be more careful and more vigilant. So like one thing is that is a suicide Tuesday. That suicide Tuesday means typically the different kinds of research findings is to believe like that the depressive period that typically occurs in the midweek. So midweek is the Tuesday actually, following the weekends. Maybe you had a party or something, and then the depressive period used to be become in peak on the Tuesday, that is in the midweek. So you have to be a little bit careful if the person is like prone to suicide. So midweek may be the problematic day. Sometimes the term has been coined by Cambridge University. They used to use the term that is Suicide Sunday. What does it mean? They used to refer this Sunday immediately after the end of the summer term. Why they have coined this kind of term? Because we can see if the students has already given the exam, but the results is awaited. So that time, if the person has does not done well in the exam, so the chances and potentiality of committing suicide increases. So that's why they used to coin this term as Suicide Sunday. And some common beliefs or mental image we are having, like during the winter season or winter days, mostly the suicide proneness, committing suicide tendency used to increase. But the research data and all that used to say like that late spring and early summer months is the month when suicide rate used to increase. So we need to be a little bit careful during all these days. Few research data used to say is like that that one more term, that is the suicide Monday, because they think like that throughout the week you have done the work, and Sunday you have taken rest or something, and from the Monday you need to start freshly, right? But if the person is depressed, or if the person is thinking like incapacitated, so the person will not be able to start freshly. So that suicidal thought used to increase during the Monday. So that is known as the suicide Monday. So this all things you need to keep in your mind. If the person is prone to suicide, yeah, if different kinds of risk factors and warning sign you have already encountered. And you have to, if the person is depressed, then you have to at least watch the person in the morning time also, because in the morning time the depression feelings is to increase. Yes. Uh, so you may remember this acronym to remember at a glance. Like if you are seeing that person is agitated, if the person is suffering, persistently suffering from low mood, and suddenly the activity has been increased, and the person is taking more alcohol than the previous, and if their rhythm has been changed. Rhythm can be in any form, in case of emotion, in case of habits, in case of nature, in any form. If it is increased, if there is any kind of changes, then you have to think about. And the BAILS acronym stands for, if you see any kind of new or dangerous or troubling type of behavior, and if the person is expressing different kinds of negative thoughts like helplessness, hopelessness, worthlessness, and the guilty feeling, and the person has locked himself away from everything, and isolated himself, withdrawal from everything, then you have to then you have to think about and looking for ways to die, and statements of death being a solution to problems. So like that way, the if you are seeing this acronym and these kinds of behavior, then you have to take it seriously. So now let me tell you the mention different times kinds of risk factors. So if any family members who have already attempted suicide, if there is this kind of family history is already existing in your family, like first degree or second degree family member, yeah, within the twin, so then you have to take it seriously. Yeah, having made a previous suicide attempts already, if the person is consuming alcohol or other substances, if you're seeing that person is actually the person's nature is very much impulsive, the person is to take the actions without even thinking about the consequences. If the person is having easy access to different kinds of lethal means, it may be the pesticide, it may be the rope, it may be the cloths, it may be the tablets, whatever it is. But if there is any easy access to the lethal means, then you have to think about. If the person is suffering from hopelessness, helplessness, or worthlessness, that means the person is showing the depressive sign symptoms with the guilt feeling. And if the person is already feeling very much lonely, if it can be like that, if the person is not having that much supporting hands, not the immediate family members, the person is not having immediate family members, so that can be the risk factor. And already suffering from the depression, that we can utter like major depression. And any kind of sudden stress or setback due to relationship problems, it might be any kind of failure, it might be any kind of family problems, marriage problem, it might be educational related problem, it may be the financial problem, anything, sudden failure or sudden problems if arises, and that has increases the stress, so that will be the predisposing factor for committing suicide. And any kind of physical illness, like the person is suffering from cancer, yeah, the person is suffering from AIDS, which is very much stigmatized. In case of cancer, there is chronic unbearable pain is there, and any kind of severe disability like amputation of lower parts or amputation of something, so that might increases the chances. So that's why we used to call these all are the risk factors. So now I'll be entering into a little bit theoretically. Theoretically, if we can see like that. These are the major psychiatric disorder where the chances increases, like if the person is suffering from major depression, schizophrenia, drug or substance abuse if it is there, dementia, delirium, personality disorder if the person is suffering from. So the chances increases. If the person is having already diagnosed physical disorders like which is incurable in nature, stigmatized in nature, that increases the chances. If the person is having different kinds of psychosocial factors like failure in exam, and dowry harassment, because of this society, dowry harassment is one of the major problems in case of girls, and in case of women, what we can say. And marital problems like divorce, and it may be divorce, or something, the problems between the couples, between the family members. And if there is loss of loved object, that is there, the death of someone, isolation and alienation from social groups, if other social members are avoiding the person, so that might be the reason. And the person is having some financial or occupational difficulties, if the person's previously the person was employed, now the person is not employed, either the person is having so much financial burden, so that might be the reason. And if you want to see according to the genetic that I have already mentioned in the risk factor also, like if the person is having the already the family member is affected from, yeah, the family is already has been there, then it can be. And otherwise, if you want to go more theoretically, like 18% it is in case of monozygotic twin. And biochemical factors, so that is the 5-hydroxyindolic acetic acid. If there is low level of 5-hydroxyindolic acid, the person should be more victimized. So these are the etiologies. Now I'll be talking about a little bit about the survey that has been done by the National Crime Record Bureau. So that is the data during 2021. This data is of Indian data, like in different states. So what they have finded out, the percentage of various causes of suicides around the states are mainly the family problems, then the drug abuse and the alcohol or the addiction, marriage related issues, any kind of bankruptcy, yeah, unemployment, professional or the career problem, poverty, property dispute, failure in examination, fall in social reputation which is previously existing, and suspected of any kind of illicit or extramarital related relationship, any kind of impotency. So these are the major findings in India. So now we'll be seeing the according to the profession, the percentage of distribution of suicide victims. The data is of in the year 2021 that has been collected. So like we can see, majorly the daily wages earner, they are the major victim. Otherwise, housewife, professionals also, unemployed persons also. What we need to quote and what we need to note that one of the major population is students also. So that there we need to work on, because these are the, actually we can call that it is the premature death. And simple awareness can prevent all these kinds of death issues. So next, what we can see according to the education status. Education status, what we can see, like it is more prevalent into when the person is education level is secondary level. Otherwise, also it is prevalent in middle level also, and higher educational level also in India. Yes, this data you need to remember very clearly, like if the person is having Okay, is it visible now? Fine. Okay, okay. Hmm. How far it was audible?
It's fine. Audible now. It's audible. No issue. Since 5 minutes was not audible.
How far it has already been covered, sir?
From last time.
Uh,
From yeah.
from where I need to start again?
Here from here only.
This all has been done, sir.
It is done,
Verbal
madam.
cues.
The percentage also done.
Risk factors has done, sir.
Yeah,
Etiology.
everything done, madam. That percentage this chart. Yeah.
Okay. From
Yeah,
this chart, I need to start again, right?
exactly.
Okay, okay, okay. Thank you so much. So, in case of if you want to go according to the education status, what you can see, like it is more prevalent in case of secondary level, that you can say see, and it is also prevalent in case of middle level educations also, and higher secondary educations also, and primary level also. But that is the thing you need to remember. This is the Indian data, so we have to look for it, like it is more prevalent in case of secondary level education. Yes, this data is very much important. Why this data is very much important? Because if you go through the books and all, we used to see like that, okay, the modes adopted by the victims to commit suicide is Ganzut or something. Because mostly that these are the data from the foreign countries. But if you see the Indian data, the mode of adopted by the victims are mostly by hanging and by poisoning. You can see by drowning. So these are the major thing they are these are the major thing or major modes they are adopting for committing suicide. So that you need to be careful. Why? Because these potential things you have to keep aside from the persons. Yes. Now we need to know about the protective factor. Why we need to know the protective factor? So that we can help the person. The first and foremost thing is that who can help? The family member can help. The friend can help. The colleagues can help, because they are the only they knows the persons, and they can be the good support. Okay, and so this is the if the person is already having the good friends, good family, good colleagues, they can be the supportive factor or protective factor. Ability to find solution. A few persons are like that, they can able to solve the problems. Might be for that intense feeling, might be for that intense problem, the person's not be able to do that. So if you are helping the persons, that person can able to do that. So if that kind of personality is existing, so that is a protective thing. So have overcome previous problems also. So have helped others who were in distress. Cultural and religious beliefs the person is having, and easy local availability of help, providing hospital if you are having around. So that will be the additional protective factor, because you can refer the person. And if you know the counselors, doctors, and all those things, so if they are available near about you, so that they can be the protective factors. So what is the need of the protective factors? Because if protective factors are there, that can offer the sense of support to the person. Even you can reduce the negative thoughts and feelings, and decrease the sense of loneliness. So these all things are needed. And if you can solve the problem, it will increase the self confidence also. And allow the using previous experiences to overcome their current distress. So might be for that timing the person has forgot about these things, but if any helping hands are available, they can remind that persons about those things, and permit identification of alternative solutions also. That's also will be helping you, and make them pause. That is very much necessary, and not act out on their suicidal thoughts. Pause is only possible if persons are around you, if you are having the good protective factors. Okay, so now the strategies to prevent suicide. So there are so many strategies, but what the things we need to remember? We need to remember, like first we need to identify the stages. It might be the person is attempting suicide. It might be the person is having the suicide thoughts only. It might be like the person has already committed, tried for committing suicide, and came in very serious situation. So it totally depends on the stage or phase. And And what the intervention you have to do, that need to be the multidimensional and with the multidisciplinary team. Why? Because you'll be needing the psychiatrist, you'll be needing the general physician, you'll be needing the social worker, family members, society members, each and every one you'll be needing for the help. So the strategy, it starts with the individual. You need the community, you need the society, and you need the some interventions in the national and international levels also. So before starting with the individual, I just want to utter few words regarding the effective parenting, because we all know that the morning shows the day. So everything depends on your parenting, like how you are rearing the child. So the personality of the child will be like that almost. So we all know that the parenting is very much exhausting, very much challenging phase of life. No one is perfect. We need to go through the trial and error thing. But what are the things we can keep in our mind? We can create the supportive environment for the child. Like if there is any failure, your child should know that my parents are there who is going to support me. The positive environment, like praising the child, like giving the good comments. So these all kind of positive environment, good relationship with each other, good communication. So these things should be, there is no double bound communication, no pathological communication. So these all things are the sign of good parenting. And what you need to do, you need to spend quality time. We all know that every parents are very busy nowadays, but the thing is that you have to keep some quality time aside for your child, so that you can be with your child on that timing. Believe in your child, believe in the potentiality of your child, that should be there. And try to appreciate your child. We all know that the parents wants good, they want the good thing for the child only, but sometimes you need to show also, like how much you love the child. And if something they have done, yes, it is a good thing you have done, that appreciation needs, because this all appreciation will boost your child's self-esteem. So that's why this appreciation is very much needed. And what you are very you can't do, that is, don't compare your child with others child, because every child is unique, every child is having different kinds of potentiality. So please don't compare, even with don't compare your elder child with the younger also, because every child is unique. So that you need to keep in your mind, and demonstrate balance and healthy responses every time. We all know that we are very much occupied with our occupational stress, financial stress, and everything, but never ever so that argument fighting between your couples or something, or between your family members just before the child. So that kind of balance and healthy responses you need to inculcate in your family. So next is know about their friendship. That is very much important. You need to know about the peer groups of your child, so that at least you can closely observe it, and you can pretend what is going to happen, and in which stages your child is. So that is very much important. And your children are not means to satisfy your unfulfilled wishes, that you need to remember. Like कभी कभी ऐसा होता है कि मैंने I can't be a doctor, so my child will fulfill my unfulfilled wishes. It is not. So your child might be having the different dreams, so let cherish his or her own dreams, not yours. So that you need to keep in your mind. Child can make mistakes, that idea should be in the mind of the child, because making mistakes is not a problem. Everyone can make mistakes, we used to learn from the mistakes. So this is allowed, so that need to understand. And what parents need to understand, that every child is unique. It's not like that that person has got the 90%, so your elder son got 90%, so your younger son will be getting the 90%. Every child is unique. Maybe your younger one is good in dance, good in music, so let's cherish their own dreams. So that is being very much needed. And you need to remember that every child is unique. and keep aside times, because you need to listen to them. If you're not listening to them, after some time they will not disclose the things before you. So that then so many things you can't able to understand, and that will be the child also will be trying to hide so many things. And one more thing, express yourself. Express yourself means, if you find that something is appreciable, something you don't like, something should not be done like this, so you can express yourself. You can set the rules and limits in your family, not the strict one, be flexible, but you can set the rules and limits so that the person, so that the child can understand the rules and the limits. And this is most important, prepare them for the challenges. You need to make them understand life is not like that, every time high, that will be the high things. It will be the like coaster, like the downs will be there, so you need to face the downs also. And some life hacks, or the you need to teach the some basic skills so that the your child can survive. So that is the rearing you need to remember, because this is the foundation. If you rear well, so later on the process will not be like this. And this is my most favorite, the thing is that, please don't be biased with the girl child. If when you are rearing your boy child, in the same way try to rear the girl child, because the burden is increased for the girl or women, for this discrimination. So here I have mentioned one of the project, actually, that is known as the Mogu. I like this project. Actually, that Mogu means the flower bud, and this total Mogu word means mental health for going girls growing up. So that is the project of Nimhans. So their main motto was that let the flower blurs bosom. They have worked for the mental health needs of young women who are actually needy, comes from the needy family. So if you are rearing well from the beginning, and if there is no discrimination, so this kind of there is no need of these kinds of projects. And um, uh, this kind of discrimination and all used to multiply the intense thought in case of women or girl child. So that you need to remember. Yes, now I'll be coming in the individual level. So in individual level, what you can do, you can help yourself. Like the first and foremost thing, what you need to remember, like it is okay to ask for help. There is no harm. See, you can seek help anytime if you need. And if someone else is needing, support each other. So that is the thing is very much needed. And if you are having some intense kind of thoughts or something which is unbearable, so what you can do, you can do some destructive activities so that you can that can help you to divert yourself from that thoughts. You can use the thought stopping technique. You can postpone or pause, like I don't want to think regarding this now. So like that, you can postpone or pause the thought. And you can distract yourself, and you can engage yourself in different kinds of hobbies. You can do practice the journalism, so that at least your ventilation can be there in any form. And one more thing you need to remember, if you're already taking any kind of psychiatric medicine, yeah, if you're taking any kind of medicines in which you are habitual, don't stop it, because sudden stop might intense your feeling. So that you need to remember. So these are the self-help strategies that you can adopt. And what you can adopt at the community level. Community level means, sometimes we used to see like that, farmers used to come from the, that is a general idea, like they used to come from the low socioeconomic condition. Yeah, they are suffering from the financial issues. And and we all know that in farmers house the pesticide is very much available. So what the prevention, as a prevention, what we can do, like we can cultivate that culture, like pesticide bank, so that all all kind of these kinds of pesticides should not be readily available to the farmers when they are suffering from these kinds of intense feelings. So there we can prevent the committing suicide rates. One more thing we can practice, like microfinancing. Sometimes the firm, if the farmers or some persons are from coming from very low economic socioeconomic conditions, so there we can help the persons, like help the persons like opening a bank account in the bank, yeah, providing loans for the micro for the small business and all. So this is known as the microfinancing. And we need to limit the availability of the substances so that it should not increase the rate of committing suicide. And we can any kind of awareness campaign we can in culture, like awareness campaign we can arrange any kind of awareness campaign, and motivate for seeking help. That is very much needed because you need to understand that anytime we can ask for help. So that motivation should be there within that individual. And you can take help of the support peer support groups also. Peer support groups like they can help the transgender prison population, survivor of domestic violence, sexual violence, or acid victims, or already survivor of suicidal attempters. Because if they share their experiences and how they have come out from that situations, so that is going to help the others. And student they are having more energy, and the adolescent population, so you can utilize the students also for these different kinds of awareness campaign. And you can use the teacher and the local leader also, because they have the very good influence in the community. So you can take help of them during the awareness campaign. Either you might train the ASA workers, Anganwadi workers to continue the awareness campaign. And we have to be very much careful about any kind of bullying. Don't bully each other. It can be in online, it can be in offline. If you have stopped this kind of bullying, so the rate automatically, the intense feeling, the pain automatically decrease, that emotional pain. Yes. So what we can do in a national and international level? So we can think for different kinds of laws, policy, and different kinds of preventive programs. Technological based support and training, like we can think about different kinds of suicide prevention apps and all. We can stop the cyber bullying. And your media also should be very much responsible. Very much responsible and sensible reporting should be there. The positive, that media should also create the positive environment who are in social media or something, so that if there is positive environment, then automatically the rate will be reduces. And in the national and international level, always the, if there is any crisis, if there is any disaster, proper preparedness should be there, and intervention preparedness for the intervention should be there, like with the counseling and with the proper team of counseling and psychiatrists, so that if something happens, so we can take care of it. Yes, here I have mentioned few strategies. Actually, these are the strategies according to the acronym. You can remember that strategies we have already talked about, but according to this acronym, you can remember like feel and tackle strategy. So what does it mean? Feel, like focus on the person, encourage for the free communication and the open communication, and express their concerns and understanding. And what you need to do, you need to listen very attentively. And tackle means time, give adequate time to that persons, because all the things they want time. Some wants to listen to them, and someone should support them. And the approach, like persons in distress, with respect always. Don't be judgmental, always try to respect, because you can't understand their pain, because you are not wearing their shoes, so you can't understand their pain. So just approach, your approach will be like with respect. Care, show the care when inquiring something, so that the person can understand the empathy. Know, understand the problem, and importantly the persons you have to know. Locate space to offer privacy. So each and everything you need to maintain the confidentiality, and empathy and the non-judgmental attitude. These two things you need to inculture within you. So next strategy according to the acronym, that is pause and lift strategy. Pause and lift strategy means postpone and promise not to act on suicidal thoughts. So that we used to call in our technological term like contract. Uh, we need to sign the contract between the patients and the nurse. And active, like start physical or mental activity activity to distract yourself. Hobbies that can be used to provide pleasure, that you can use. And stay, that means physical proximity to near to dear ones, that is within the family members, yeah, your near and dear ones, before whom you can ask for the support. And engage on any task or work with others, so that is the pause technique. And lift is look for someone to share your concern, so that you can verbalize yourself, you can ventilate your mental burden. Inform, seek helplines, so many helplines are there. You can take help from each and every state, each and every state, even each and every city also, we are having different kinds of helplines, so you can seek help from them. Follow up with care provider supporter is very much needed. And what more thing is needed, that is the trust others and yourself, that his will be, this all things will be, you can able to overcome all those things. So that is the pause and lift strategy. And speed stop is one of the strategy, like speak out. You can take help of the helpline or friend, but what the things is needed, speak out about this thing. Postpone, like give yourself some more time. The things is automatically will get resolved, just give yourself time. Express, like write your thoughts and feelings, verbalize your feelings and all those things. Engage in activities that provide you the pleasure, so any kind of hobby or anything, you can engage yourself to divert yourself. And distract using activities that interrupt your suicidal thoughts. So that is the thing you need, that is known as the speed stop. And stop means, stop you can say like stay close with the family members, yeah, near and dear about. Try to trust himself, or that is the confidence you should have. And occupy, try to occupy yourself and protect yourself. So that is the stop technique. So now I'll be talking about few mm, theoretical aspects, like sometimes if the patient is already with you, yeah, then how you need to assess the patient. So you need to assess the injuries, medical conditions, about the attempt, that is the primary concern that you need to assess. You need to listen carefully, accept the patients as it is, and mm, uh, and note their complaints and feelings. Do not show any kind of disgust or horror. So, and do not trust rapid recovery. Sometimes the you can see like that ki, patient is showing the positive attitude suddenly, so that is the rapid recovery. So don't trust on that things, because you already know that might be for days, even for months, this intense feeling. So that you need to remember. Do not try to deny that the attempt occur. Okay, so that you need to remember. Never challenge the persons, okay, go ahead. So it's not like that they will not do it, they can do it. So this is the scale what we used to use, that is known as the sad person scales to assess. So here you can say, you can see the 10 according to the acronym, 10 options are there. So like first you have to think, you have to take the history, like sex, if it is male sex, then one. Age, if it is below 19 or over 45, then one. And the person is having the depression, previous atoms, excess use of alcohol or substance use, rational thinking, if if it is there impaired, and social support is not there, organized plan is already there, if the person is not having any spouses, and the sickness is there. So these are the 10-point scale. What we can say, if the person's got the rank from 0 to 4, then the risk is low, 5 to 6 is medium, and 7 to 10 is high. So how we manage that, you all know about it. Like if the person is in your hospital proximity, so what we can need to do, like we have to be very much aware about the warning sign, and you have to monitor the all patient safety needs, all the means of committing suicide. You have to remove all those things from the patient's bedside, and you have to closely monitor the patients. So you have to spend time with the patients, allow for the ventilations, allow, encourage to talk about the plans and all those things. And yes, no suicide agreement may be signed. So that we are talking about the contracts. So no suicide contracts agreements should be signed between the caregivers and the patient. And try to enhance the self-esteem of the persons. You can focus on the strength of the persons. It's not like that all the persons is having the failure in his list. So many achievements are also there you can focus. So acute psychiatry emergency interview you can take, you can go for the counseling and the guidance and the treatment. counseling guidance, you can teach the positive coping skills and problem solving skill to the person. Yes, if the person has already attempted suicide and came in very serious condition, so we have to treat the patient seriously like emergency patient. Yes, that the things I need to mention. Like previously, committing suicide was criminalized, but in Mental Health Care Act, according to Section 115, that the act of that committing suicide act is already been decriminalized. Why decriminalized? Because if the person is survivor, so that increase the burden. So mental health, all all the things is matter, that is the mental health. So for that is that things that according to the Mental Health Care Act, the suicide has already been decriminalized. Yes, so who can help to prevent the suicide? So I have already mentioned it's not like that always the person should be the qualified or the professional persons. Anyone can be the person. We all know that everyone has some unique potentialities. If you are very much motivated and desire to help someone, if you want to spare your time, if you want to spare your energy, if you want to help someone, so always welcome. Yes. So if the person want to help, so there is one already evidence-based and community-based approach or training is available for the common people. So that is known as the gatekeeper training. So that has been developed by the Center for Mental Health Law and Policy. So who are the gatekeepers? Or gatekeepers is someone who believes that suicide can be preventable at the community level and is willing to give the time and energy for this cause. So what in this training, what we used to do, we used to empower the gatekeepers with the required knowledge and skills so that the persons can work as a gatekeeper, can build a network of gatekeepers, and uh, can prevent the suicidal rates. And this gatekeeper training is based on the World Health Organization's Mental Health Gap Action Program. Yes, so if you wish to know more about this gatekeeper training, so you're free to call to the Nimhan Center for Wellbeing. So they have already given their phone numbers and email ID also. That is an online, this training is to be done in online platform also. And other trainings, what you need, what is required, that is the psychosocial first aid training. So it is not like the general first aid, like you need to run with the bandages, you need to run with the injection or something. What you need to show your respect, your empathy, your compassion, and the supporting attitude, and the time and energy to listen actively to the persons. So that is the thing only is needed for this first aid. So you have to have the idea about the helplines. Each and every states, each and every cities, they are having the suicide prevention helplines. So you can distribute these helplines numbers to that persons. So now I just want to conclude with now we can understand what are the aims of World Suicide Prevention Day. So we can conclude like that. By celebrating World Suicide Prevention Day, what we can do, we can raise the awareness that suicide is preventable. We can improve education about suicide. We can spread the information about suicide awareness, and we can decrease the stigma. And how can we celebrate the day? Yes, we can celebrate, like we can launch new government initiatives. We can arrange any conferences, open days, any kind of educational seminars like today is going on, that is the guest lecture or public lecture. We can take help of the media. We can do some memorial services like candlelight ceremonies for those persons, and organize cultural or spiritual events also. We can launch publications about suicide awareness and prevention. We can conduct different kinds of training courses also. Yes, so I don't know how many participants are there. If participants are there, so you can utter the plays with me, like suicide is preventable. So we can take this place, like I place that I will tell someone if I need help. Be aware of the suicide warning signs in others. Ask directly about suicide if I am worried about someone. Listen without judgment and do what I can do keep them safe. So that is a plate we need to utter and we need to take. So, what are the take home messages of this today's talk? Like what we need to remember, suicide is not the answer, it's only the destruction. Everything we are having alternatives. So, no matter what happens or how bad it seems today, life will go on. Just what you need to do, you need to keep patience. So, there will be a better tomorrow. And just remember, the darkest hour also has only 60 minutes that you need to bear with. And hope is necessary for normal life and the major weapon against the suicidal impulse. And never underestimate the person who are in pain, because all honestly everyone is struggling. Till now we are not wearing their shoe, we can't able to understand their pain. So talking openly about suicide and providing a non-judgmental space for discussion is very much necessary. And effective suicide prevention strategy, what we can say like that, we have to need to aware the people more and more. We have to refer the persons so that they can utilize the mental health services. And whatever the already crisis helplines are there, that they should utilize all those helplines. So just remember, it's okay to ask for help. Even if you're asking for help, that is also okay. If you're helping others, that is also okay. What you need to stretch the hands. Either you have to hold the hands. Thank you. If you have any questions, you can go ahead.
No questions further, ma'am. So, indeed, life is precious and it's important to prevent the suicidal attempts and thoughts. So, we have seen many aspects which you have told, as an individual, what we can do, as a community, what we can do, as a parent, what can be done, and as professionals, what can be done. So, thank you for such an informative session. So I now share the screen with Mrs. Gunjali, Faculty of Mental Health Nursing at Panna Daima Subarti Nursing College, for a word of thanks.
A very good afternoon and Jai Hind. I am Munjali Singh, faculty from Panadhaima Subharti Nursing College. I feel pleasure to deliver a vote of thanks on the guest lecture on suicide prevention and awareness. Place your hand over your heart. Can you feel it? This is called purpose. You are alive for a reason. So don't ever give up and live your life to the fullest. First of all, I would like to thank our respected Principal Madam, ex-Captain Professor Dr. Geeta Parvanda, for providing us and our department to organize the guest lecture. Thank you, ma'am, for your continuous guidance and support. Next, I would like to thank my dearest and respected Madam, Mrs. Betsy Chakraborty, Assistant Professor, AIIMS Kalyani, for delivering an absolute and complete knowledge on suicide prevention and awareness. Thank you so much, ma'am. I feel pleasure and honorable. Next, I would like to extend my thank to our HOD, Associate Professor Mr. Anand Ella, for his continuous guidance and support. Last but not the least, I would like to extend my thank to all the faculties of my department and all the delegates and participants who have attended this webinar actively and participated well. Thank you, everyone.
So thank you, ma'am. It can be hard to talk about suicide, but sometimes we have to have difficult conversations to keep the people we love safe. If someone is in your life going through crisis, it's easy to feel powerless in your ability to help them through something of such magnitude. But you are not powerless. Just by being there for someone, you can help save their lives. So let's join our hands together in creating awareness and prevention of suicide. Let's help someone who is in need of a support. Let's give hope to someone for living. So thank you so much, ma'am, for a very informative session. And thank you to everyone who has joined for this session. Thank you and have a great day.